Let's talk about the investigations you need to do in a patient with suspected systemic sclerosis. I will tell all the investigations and I'll also tell the expected findings. So first, if you have a suspected patient, do a CBC with ESR. You will expect the ESR to be high, but the CRP will be normal. So that's the basic test you do for any patients with inflammatory disease. Then you would like to confirm the disease. And for confirming the disease, you need to do serology. The common test is like antibodies, ANA. ANA is positive, but it's not specific. For diffuse version of disease, you need to do two antibodies. For diffuse, two antibodies. Number one, anti-SCL70, which is also known as anti-topoisomerase 1. Anti-SCL70 or anti-topoisomerase 1. Another antibody for diffuse disease is anti-RNA polymerase. Anti-RNA polymerase. Remember one thing, anti-SCL70 corresponds with pulmonary involvement and renal involvement. If the titer is high, you would expect the patient to have renal or pulmonary involvement. That is the importance of anti-SCL70 or anti-topoisomerase 1. But RNA polymerase is also positive in patients with diffuse disease. In patients with limited disease, you will find what? You will find the anti-centromere antibody. Anti-centromere antibody. So those are the serologies that you need to do in a patient with suspected systemic sclerosis. Then comes the lung involvement. For seeing the lung involvement, you start with the X-ray. In X-ray, you will find the features of fibrosis, such as you will find the reticulonodular shadow, especially in the basal regions. Then you will do the HRCT scan of the chest. In HRCT scan of chest, you will find four things. Four things. What are the four things? You find GG, you find RN, you find honey, and you find ecstasy. What is GG, RN, honey, and ecstasy? GG is ground glass opacity. What is RN? RN is reticulonodular shadow. Honey is honeycombing. Ecstasy is bronchiectasis. You will find bronchiectasis, which is also known as the traction bronchiectasis. So you do the X-ray, you do the HSCT, then you do the lung function test. In lung function test, you start with spirometry, you do a 6-minute walk test, and you also do the DLCO. In spirometry, you will have a restrictive pattern where you will have a reduction in FEV1, reduction in FVC with maintained ratio. Reduction in FEV1, reduction in FVC with maintained ratio. That is the most important thing. And you also find the lack of transfer leading to decreased DLCO or decreased KCO, or you can also say TLCO. TLCO and DLCO are kind of the same thing, but KCO is kind of different. So they are all decreased. So reduction in volume but maintained ratio, reduction in gas transfer, and the 6-minute walk test will show that the patient has hypoxemia after walking. So the patient has reduced ability to transfer the gas across the thickened membrane. So they will have exercise desaturation. So those are the tests for lung involvement or the DPLD. Then if you want to see the heart involvement, do an ECG, do a echo, and you can also do cardiac cath. For involvement of the stomach and involvement of the esophagus and GI, you can do other tests. Like for esophageal involvement, you can do a barium study, or you can go manometry or esophagoscopy, barium study, manometry, esophagoscopy. For GI involvement, which causes SIBO, small intestinal bacterial overgrowth, you can see the hydrogen breath test. For renal involvement, you can do urine RE, serum creatinine, urea, and even you can do a biopsy. But one of the most important tests that I still have not touched is the systemic sclerosis test. I mean the test from skin. So you have to take skin biopsy to confirm that this is, yes, there is sclerosis in the system. Or what system? Mainly in the skin. It starts in the skin. So what are the findings? What are the findings you get when you biopsy the skin? The findings you get start with the word systemic sclerosis. So there will be sclerosis in the epidermis, in the dermis, and in the vessel. 3 structure. Start from epidermis, then dermis, and then vessel. Everywhere there will be sclerosis. For epidermis, if you have sclerosis in epidermis, the epidermis will be thin, and sometimes it may be absent, may become absent. The epidermis is very thin. Then in the dermis, you will have fibrosis, excessive fibrosis, and there will be increase in the number or amount of collagen. And there will be so much fibrosis that all the dermal appendages will become absent. Then around the vessel, you will find inflammatory cells, and in the vessel, inside the vessel, that intima will proliferate. There will be sclerosis in the intima. So intima will proliferate, and the vessel will become narrow. So those are the biopsy findings in a patient. Those are the skin biopsy. Those are the skin biopsy findings in a patient with systemic sclerosis. I think I've covered all. So that's all. Those are the investigations you need to do in a patient with systemic sclerosis. Covers all.